Hello everyone. I'm really sorry because of my tight schedule and my previous commitment to my patients. I cannot take your lectures every day, and thus I have been not coming live since a week. So I've just decided that I'll record my lectures and post them on this channel. So kindly subscribe, click on the bell icon and stay updated. Whatever doubts you guys have after this lecture or during the lecture, you can just post it in the comments, and whichever topic you want me to take up in the next week, you can suggest that too in the comments. Okay, I hope I'll be able to stay active with you all. And so because many people have approached me from final year asking me to give my viewpoints on pulmonary rehabilitation and how to write the exam answers for the same, I have taken today's topic for discussion as pulmonary rehabilitation. Okay, so we'll just start. What is pulmonary rehabilitation? Basically, this is the answer to your definition of pulmonary rehabilitation. I have taken this definition from, you can see here, Chest Journal of 2012, and I have divided the definition into, you can see the highlighted first letters here in the type of mnemonics. This will help you to remember it in a better way. It says, the Chest Journal of 2012 says that pulmonary rehabilitation is an evidence-based, multidisciplinary, comprehensive intervention that is integrated into the management of individuals with chronic lung diseases. Okay, this pulmonary rehabilitation aims at reducing the symptoms, optimizing the function, increasing the participation of the patient in their daily activities, and reducing their utilization of healthcare resources. So, as we can see here, the definition itself says that it is a multidisciplinary team, it is evidence-based practice, which is a comprehensive intervention, okay, which is integrated together into the management. So, it will obviously require a lot of team members to bring about this holistic approach for rehabilitation. So, the team members of pulmonary rehabilitation are chest physician, physiotherapist, dietitian, caregivers and family members, the nursing staff, occupational therapists, psychologists, intensivists and social workers, or anyone who comes across the patient who is included in taking care of the patient will be included in the team of pulmonary rehabilitation. Who are the people who need pulmonary rehabilitation? The people suffering from diseases, from the diseases which I have listed here. It's not necessary it is limited to only these diseases. There are many more which are related to lungs. Because I have stated umbrella terminologies like COPD, ILDs, pre and post operative abdominal and lung surgeries, any surgery where they've used anesthesia. You all know what effect does it have on your respiratory system, and thus every patient after the surgery will require not pulmonary rehabilitation as a whole, but a little pulmonary management and breathing exercises, as we know. So, to say in short for you all to write an exam, that what are the indications for pulmonary rehabilitation? You have COPD, asthma, bronchiectasis, chest wall diseases, cystic fibrosis, ILDs, pre and post-operative lung and abdominal surgeries, post-polio syndromes, some selected neuromuscular disorders, like you can say axonal neuropathies, your muscle dystrophies, where there are chances of respiratory muscles being involved, lung transplant, lung volume reduction surgeries, etc., can also be included under pulmonary rehabilitation. So, if you get any of these cases for 15 marks for long answers, you can include all the goals, all the interventions that we are going to talk about today. So, what will be exclusion criteria, relative contraindications of pulmonary rehabilitation? We all know, before starting any treatment, any therapy, before knowing the indications, you should always know the yellow flags, red flags, or contraindications, and people you need to exclude from your therapy. Okay, it is very important to know that. So, here I have listed some of the exclusion criteria. Those are also relative contraindications, that is, you have to take a little care, and then you can go about with your rehabilitation procedure in these patients. The patients which have certain affections which may interfere with the rehab process, for example, osteoarthritis, last stage cancer. Now you must be thinking why I have mentioned osteoarthritis and last stage cancers, etc. here. It is because once you see what are the components of pulmonary rehabilitation, you guys will understand that it is a holistic approach. It includes exercise therapy, it includes endurance training, strength training, etc. So in people who have severe OA, who are being posted for knee replacement surgeries, those who have some kind of fractures, those who are ill on the, they have last stage illnesses, they are not going to respond well to your exercise therapy. Although some components of pulmonary rehabilitation you can give them, others you'll have to refrain from including them in exercise therapy as a whole. So that is why it is relatively contraindicated. You have to assess according to your knowledge, according to your understanding. You have to make sure that you give them the exercises that are beneficial for them. Okay. Disruptive behavior, any psychological conditions, like here I have mentioned dementia, or any kind of psychological condition where they are not able to comprehend what you are telling them, what is your outcome, what you need from them. Obviously they are not going to respond well to the entire therapy, so there you will require psychological interventions along with your physiotherapy interventions. Condition that might place the patient at an undue risk during the exercise protocol, for example pulmonary embolism, unstable angina, myocardial infarction, or pulmonary hypertension, etc. So if the patient is on bed for a long time, you do not just make the patient sit, stand and do exercise therapy as a whole at one go. You have to progress slowly. Otherwise you'll risk the patient to pulmonary embolism, unstable angina for the patient who's already contracted an MI, etc. So there you need to be careful on your decision making. Some metabolic diseases like diabetic patients or musculoskeletal metabolic disease like osteoarthritic, osteopenic patient. So all those are relatively contraindicated. Although some components you can take. Okay. Now what are the goals of pulmonary rehabilitation? These are collective goals, not only physiotherapeutic goals. These are collective goals. If you take the other professions perspective and as well as physiotherapy perspective. So these are the goals you can write when you are writing goal formation for any patient with respiratory disease. So you can see here, reduce the severity and frequency of the symptoms. Symptoms will go according to your condition. Like patient with COPD will have excessive coughing, breathlessness, cough production, mucus production, etc. Then reduce the dependency of the patient. Dependency on what? This you have to fill in according to the case you get during your exams. Dependency on smoking, dependency on alcohol, dependency on other kind of drugs or whatever dependency he's having, as well as dependency on the family members to carry out his day-to-day activities. Improve the mood and motivation of the patient, increase the participation of patient in daily activities, improve the quality of life. All this you will do will improve the quality of life of the patient. Decrease the burden of healthcare on patient's family as well as the community. Healthcare is kind of expensive,